So let's spend a little bit of time talking about medicine in the future. You know, this may end up being medicine in the future. Let's look at this little cell phone. Let's pretend you're in the doctor's office. Let's pretend that he's examining your heart. He takes his stethoscope and he listens to your heart and he figures out if it's beating properly and the rate and the rhythm that's there. Let's say he finds something wrong and he sends you for an echocardiogram or an ultrasound. Let's see if he could do that at the bedside. So let's plug into our cell phone a little ultrasound probe that we can rub over the chest, look at our cell phone, and actually see the heartbeat, see the blood come in, see where the blood flows out, and we can see that in our cell phone. And the doctor at the bedside will be able to diagnose disease better. As a matter of fact, they took students at the University of South Carolina that had been trained in ultrasound of the heart with their cell phone, and they matched them up against the senior cardiologist, and they tried to figure out different murmurs, different heart problems. Guess who won? The medical students won every time, just because they were able to see what was going on inside the heart. Now let's advance a little bit. Let's pretend that we examined one patient, 5 patients, 10 patients today. 1,000 different medical centers. They all did 10, 15, or 20 ultrasounds. They sent all the information up into the sky, up into what we call the cloud, where they had all of this information that was coming from different people, from different ages, with different heartbeats, with different ultrasound involvement of the heart. And then the cloud began to take those tens of thousands of ultrasounds that were done at the bedside and then began to come up with normals and abnormals, and were able to tell right on the cell phone what was going on with the heart. That's in our future. Our cell phones will tell us many different things. Let's look at contact lenses. There's some contact lenses in the eyes now that will measure the blood sugar. So we can have an ongoing blood sugar measurement just by putting a contact in the eye.